Hi everyone, my name is Neha Matthew, and along with my fellow health associates, Ayan Karima Lee and Zulema Carrillo, we had the privilege of working with Dr. Ebony Caesar over the past couple of months on improving licensure efficiency for behavioral health care providers. We worked with our mentors, Dr. Kasim Butt and Lori Cook, who have taught us about multiple facets of technical database creation, such as customer discovery and competitive mapping. As health associates, we had the privilege of coordinating meetings between our mentors and leads who taught us about specific customers who would benefit most from a more efficient behavioral health workforce pipeline. Through this unique experience, we have learned how modernizing licensure databases can directly support behavioral health care providers and expand access to care across the country. Now, with that being said, let us now welcome our wonderful project lead, Dr. Ebony Caesar.
Thank you so much, y'all. And speaking of technology and accommodations, I will identify as a COVID long hauler. So mine are right here in my hand, thanks to our technology. All right. So we know Texas faces a severe shortage of mental health professionals, particularly for children, adolescents, and transition-age youth. Through the Integrated Behavioral Health Scholars, or IBHS program, we've trained and placed over 300 interprofessional scholars across underserved communities. We've proven the model. Our curriculum works, our placements work, and our trainees stay in the field. Now we're ready to expand the technical infrastructure that will help them, and the thousands who come after thrive long-term. Our next phase in the development is of a portable, interoperable licensing and credentialing database. This system will launch using the incoming IBHS cohort as our foundational data population, tracking their educational milestones, supervision hours, licensure progress, and credentials across social work, psychology, psychiatry, and psychiatric nursing. Why is this innovation critical? Because across the US, highly trained professionals are leaving the workforce due to administrative bottlenecks, long delays in licensing processing, lost supervision hours, incomplete or inconsistent records, and no universal system for multi-site credentialing. These barriers disproportionately affect professionals of color, multilingual clinicians, and those from rural communities, individuals we urgently need to retain. Our proposed system will streamline licensure tracking and credentialing across disciplines and institutions, support professional mobility by providing portable digital profiles accessible to health systems, state boards, and academic institutions. It reduces attrition by eliminating barriers to timely advancement in employment, and most importantly, elevates the behavioral health workforce pipeline by pairing curriculum and practicum work with a tech-enabled pathway to licensure and supervision completion. We're not starting from scratch. We have the workforce development infrastructure, we have the interprofessional cohort. What we need is the technology. So, am I still on? Okay. With support from Texas Health Catalyst, we will build this system, not just for our own scholars, but as a replicable, scalable tool for our customers, other healthcare systems, universities, and more. Our first invitation for funding support to scale would be extended to our payer systems. This database aligns with the growing policy support for integrated, school-based telebehavioral care. It also creates real, sustainable change by reducing administrative friction and centering workforce retention. The Integrated Behavioral Health Practitioner Empowerment Initiative doesn't just train providers. It's now building the infrastructure to keep them. Thank you for our mentors. Again, as we mentioned, Dr. Butts, who definitely let us explore nephrology and told us about how the potential would be for providers all across our ecosystem, and to Lori Cook, who let us explore the commercialization and talked about the payer systems and included our cohort. Thank you.
Thank you. Could you tell us more about your team? I mean, do you have a technical,
Absolutely. So our health associates were amazing in developing essentially what is our product. This started out as just an idea. So we actually did have to develop a product that would actually assist the population we were trying to serve, which were practitioners.
So thanks for working on this. Have you looked at other specialties or other states that have done this before?
Indeed. We actually are collecting data around PsyPact and what psychology is doing in their cross-state licensure. We are looking at what we are not doing yet in Texas around that same idea. We are also looking at the stovepipe method that a lot of us have seen already, where you have CEU trackers or licensing boards that do it state by state, but nothing that's multi-site or comprehensive.
So how does this technology solution help help with workforce challenges? Like, does it keep track of all the different things people do so they can apply easier?
It does indeed. So it would be a system that essentially creates your profile. It houses your CV and any updates you have, your hard copy of your diploma, which all of us as practitioners are having to submit, all of your licensures, all your credentialing that you have already in the system. It's one place for everything, and Dr. Butt was actually our best provider for that because he collects all of his own materials because he is that meticulous. And so he was the first person to say, I would love this off my plate.
Wow, okay.
Great.
Thank
Thank you very
you.
much.